Many men live for years with urinary changes that feel minor, inconvenient, or simply part of getting older, never realizing these changes may be early signs of an enlarged prostate. What makes this condition especially concerning is not how dramatic the symptoms are, but how quietly they develop. Most men do not wake up one day with severe problems. Instead, the body adapts, compensates, and whispers warnings that are easy to miss. By the time those whispers become loud enough to demand attention, the prostate, bladder, and even the kidneys may already be under significant strain. I am Dr. Emily Carter, a urologist, and today I want to explain the enlarged prostate in a clear, calm, and practical way, focusing especially on the signs most men overlook or misunderstand. My goal is not to frighten you, but to help you recognize what your body may already be telling you and understand why early awareness can make an enormous difference in long-term urinary and overall health. The prostate is a small gland, roughly the size of a walnut in younger men, located just below the bladder and wrapped around the urethra, the tube that carries urine out of the body. Its primary function is reproductive, contributing fluid to semen. However, because of its location, even small changes in prostate size can have a major impact on urination. As men age, the prostate commonly grows, a condition known as benign prostatic hyperplasia, or BPH. This growth is not cancer, but it is not harmless either. As the prostate enlarges, it gradually compresses the urethra, narrowing the pathway urine must travel through. One of the earliest and most commonly missed signs of an enlarged prostate is a subtle change in urinary flow. Many men notice that their urine stream is not as strong as it once was, but they dismiss this as aging or dehydration. The stream may take longer to start, or it may stop and start during urination. Because these changes happen gradually, the brain recalibrates what feels normal, and the problem goes unrecognized. From a medical perspective, however, a weakening stream is often the first mechanical sign that the prostate is beginning to obstruct urine flow. Another frequently ignored symptom is the feeling that the bladder does not completely empty. Men may finish urinating, wait a moment, and still feel as though something remains. Some even return to the toilet minutes later to urinate again. This sensation is not a bladder problem at first. It is a sign that the prostate is restricting flow, forcing the bladder to work harder and leaving urine behind. Over time, this residual urine stretches the bladder and reduces its ability to contract effectively, creating a cycle that worsens with age. Nighttime urination is one of the most misunderstood prostate-related symptoms. Many men believe waking once or twice at night to urinate is normal and unavoidable. While occasional nighttime urination can be influenced by fluid intake, consistent nocturia is often a sign of bladder outlet obstruction caused by prostate enlargement. When the bladder never empties fully, it fills more quickly, triggering the urge to urinate during sleep. Research published in urology journals consistently shows that nocturia is one of the most common early complaints in men with progressive BPH, yet it is one of the least likely symptoms to prompt medical evaluation. Urgency is another subtle warning sign. Men with an enlarged prostate may feel a sudden, strong urge to urinate that is difficult to delay. This happens because the bladder becomes increasingly sensitive as it struggles against resistance. Over time, the bladder wall thickens and becomes irritable, leading to urgency even when only small amounts of urine are present. Many men attribute this to stress, caffeine, or aging, never realizing the prostate is the underlying cause. Post-urination dribbling is another symptom that men rarely discuss, even with their doctors. After finishing urination, a small amount of urine may leak or drip, staining clothing and causing embarrassment. This occurs because urine becomes trapped in the urethra due to obstruction and weak bladder emptying. While this symptom is often minimized, it is a clear mechanical sign that urine flow is being disrupted. One of the most overlooked signs of an enlarged prostate is the need to strain during urination. Men may subconsciously push or tighten their abdominal muscles to help urine pass. This is not normal. Straining indicates that the bladder alone is no longer sufficient to overcome resistance at the prostate level. Chronic straining increases pressure inside the bladder and can worsen bladder dysfunction over time. What many men do not realize is that the bladder is incredibly adaptive, but that adaptability comes at a cost. In the early stages of prostate enlargement, the bladder muscle thickens and becomes stronger to push urine through the narrowed urethra. This compensation can hide symptoms for years. Eventually, however, the bladder fatigues. When that happens, symptoms accelerate, and complications become more likely. Clinical studies, including data published in the Journal of Urology, show that untreated BPH is a leading cause of chronic urinary retention in aging men. Chronic retention does not always cause pain. Instead, it quietly stretches the bladder and increases the risk of urinary tract infections, bladder stones, and in severe cases, kidney damage due to back pressure. I have treated many patients who were shocked to learn that their kidney function had declined because of a prostate problem they believed was minor. One patient I recall clearly was a 58-year-old man who came in complaining only of poor sleep due to nighttime urination. He had no pain, no burning, and no dramatic symptoms. An ultrasound revealed significant residual urine in his bladder after urination and early signs of kidney stress. His prostate enlargement had progressed silently. With appropriate treatment, his symptoms improved, his sleep returned, and further kidney damage was prevented. This is a common story, not an exception. Another reason enlarged prostate signs are missed is that men often adjust their lives around symptoms rather than addressing them. They limit travel, avoid long meetings, reduce fluid intake, or map out bathroom locations without consciously acknowledging why. These adaptations can mask disease progression while quality of life quietly declines. It is also important to understand that prostate size alone does not determine symptom severity. Some men with moderately enlarged prostates experience severe obstruction, while others with larger prostates have fewer symptoms. The direction of growth, bladder response, and individual anatomy all play roles. This is why symptoms, not just prostate measurements, are critical in evaluation. Diagnosis of BPH is straightforward and non-invasive. A careful history, physical examination, urine testing, prostate assessment, and bladder ultrasound can provide valuable information. Measuring post-void residual urine helps determine whether the bladder is emptying properly. These tests are not done to rush men into treatment, but to establish a clear baseline and prevent silent complications. Treatment options today are far more advanced and personalized than many men realize. Medications can relax prostate muscle fibers or reduce prostate size over time, improving urine flow and relieving bladder strain. Minimally invasive procedures can open the urinary channel with less recovery time than traditional surgery. Early intervention often means simpler treatment and better long-term outcomes. Perhaps the most important message is this: enlarged prostate symptoms are not a sign of weakness, failure, or inevitable decline. They are a common medical condition with effective treatments. Ignoring them does not make them go away. It simply allows the body to compensate until it can no longer do so safely. If you notice changes in your urine stream, nighttime urination, urgency, dribbling, straining, or the feeling that your bladder never truly empties, do not dismiss these signs. They are your body's early warning system. Addressing them early protects not only your bladder and prostate, but your kidneys and overall health as well. If you found this explanation helpful and want more clear, medically grounded education on prostate health, urinary symptoms, bladder function, and men's urologic issues, I encourage you to subscribe to this channel. Staying informed empowers you to act early, ask the right questions, and protect your health for years to come.